A patient was asking me a little bit more detail about Shockwave. Some people want to know all the details and some just go, I don't care what it is as long as it makes me feel better. Well, I'm all about providing information, so this was right up my alley. We start talking about how with Shockwave, we're trying to use the kinetic energy from acoustic wave to produce mechanical changes or forces on tissue inside the body. And by that, we were putting this big energy burst into the cells. The bad tissue is going to hit and absorb more of that than it likes. And part of that is because when tendons go to remodel, they don't always fix themselves perfectly. There's this little disorganized slapping down duct tape in random places to try and hold the system together. Think of it like trying to build some quick scaffolding so it can work on the area. And when it's done and can lay down all the fibers, it'll come back and pull that scaffolding up. But sometimes it doesn't quite get around to it and we get all this cheap patch all over the place, all these duct tape patches all over, and that's what the energy is hitting at an excessive rate. The duct tape can't stretch. When that burst of energy comes through, it's going to break those bonds. That's going to help trigger the healing and repair. So that's going to upregulate the systems that bring A, more blood vessel development into the area, B, it's going to increase the tenocyte or the little tendon cells to start repairing. It's going to increase our protein synthesis, so how cells are going to help repair along with the collagen synthesis. Collagen is that structural elements in cells, and it's going to turn on a bunch of other growth factors for healing. It also helps shut off some of the excessive inflammatory processes that we have from chronic and big acute injuries. And this comment of that burst of energy, creating that mechanical action and stresses inside the tissue, helps the healing and repair. And the treatment we're doing today has a big effect right away. It helps speed up that process, but it's also going to enhance the repair process for weeks down the line. And that's why sometimes the treatments we're doing right now, you're going to continue with those benefits for weeks on end. It's just not a quick, hey, I relaxed the muscle for a day, good to go. This is one of those long-term treatments that helps speed up your healing process and enhance the repair so that you end up with a better quality healing and tendon downstream and don't have this injury over and over again.